So welcome to the CACCN BC Fall Innovation Roundtable. We've got lots of great presenters here for you all today, and also want to acknowledge all of us that are joining today from the traditional and unceded territories of our First Nation. So I'm going to pass it over to Hannah, who's going to tell us a little bit about nursing in the media.
Thanks everyone for being here to listen to these presentations. I'll be talking today about a topic that I've been passionate about for quite a while, probably a little bit before I was even considering nursing. Just as someone who loved to watch medical dramas, I was always sort of interested in the way people who worked in healthcare were portrayed. And now that I'm a nurse, I've taken a particular interest to the way the public understands nursing and often how they misunderstand who nurses are, what they do, and especially what they know. I created this presentation for the final project in my master's of nursing that I just finished, and I've sort of adapted it to this audience. I'll just do a quick a second land acknowledgement. I acknowledge that I live, work, and am presenting on the unceded land of the Musqueam, Squamish, and Tsleil-Waututh people. So this presentation will start with a description of why this is important to me and why it could be important to all nurses. I'll go into a description of, I think, around 8 really common ways that nurses are portrayed in social media, medical dramas, and on the news. I'll talk about the impact that this has both on nurses and on the public, and some recommendations that are found in the literature, and also some ideas that I came up with after doing some research. So I care about the way the public perceives nurses and nursing because this misperception is harmful to nursing and to the public. When I got into nursing school, for example, a close relative told me, well, you know, you're already halfway there because you're beautiful. And a friend told me that I wasn't really getting a Bachelor of Science because nursing isn't a science and nurses don't do research. And unfortunately, I didn't know enough about nursing at the time to defend the profession, but I really wish I had the opportunity now. And then I also had the fortunate or unfortunate experience of doing my master's degree during a pandemic, which offered a really unique opportunity to take note of the discrepancy between the work I was doing in the ICU and how it was portrayed to the public. And oftentimes it was really nice what we were shown doing, but I found that it missed a lot of the really important stuff we were doing as well. So historically, doctors have actually done a really great job of controlling the way they are portrayed in the media, on television shows. And that's because they very quickly kind of figured out that public perception matters, and they put themselves in rooms that made decisions about, you know, how doctors appeared on really early medical dramas. And nurses, unfortunately, have not been active in this way, and they don't control the way they're portrayed often. And I'll show you some of the ways coming up that, or some of the outcomes of that. The following slides are, I think there's 8 of them, and it's the most common ways nurses are misportrayed, but it's obviously not a definitive list. So nurses here are seen as heroes and angels, and this was really obvious in the pandemic. And I think a lot of us kind of enjoyed it because it felt really like we were doing really important work, which we were, and that the public was recognizing it in a really big way. So it's not a negative portrayal, but I find it to be a little bit dangerous because heroes and angels, you know, are kind, compassionate, selfless, and those are all qualities that we sort of want to hone and are proud of having. But heroes and angels are working for free, or they're not working. First of all, it's not work for them, and it's unpaid. And I think that The idea of nurses as heroes or as angels can be dangerous because nursing is a job that people are paid to do, and we want that to be known as well. I also think that the idea of nurses as angels is a little bit dangerous as well, because it sort of conflates nursing with gendered stereotypes about nursing as women's work, and that women are naturally compassionate, caring, and selfless. Nurses are often portrayed in ways that make them invisible or absent. And this is a really chronic problem in medical dramas. So on the left, there's a screenshot from sort of a problematic television show, House. It shows 3 doctors resuscitating a patient. There's not a single nurse. And, you know, anyone who's attended a code can pretty much attest to the fact that every role played in this screenshot is usually performed not by doctors, but by nurses primarily, and allied health or respiratory therapists in particular. And I think that when you see these sorts of situations represented in this way, you sort of run into the problem of patients expecting this to be the standard of care, and maybe not realizing that when nurses are around, you are safer and you are very well taken care of. In a lot of the literature also, there's discussion about the ways hospitals will discuss nurses on their websites even, and how oftentimes to get information about nurses, the work they're doing, the innovation, the research, education, visitors to the website are often directed to the careers website, as if discussion about nurses is really important for future nurses or potential hires, rather than information that the public would really like to learn about. Nurses are often described as doctor's assistants or doctor's apprentices, and nursing is sort of seen as a stepping stone to medicine. I'm not sure if anybody here has had the experience of being told, you know, you're so smart, why didn't you go into medical school instead of nursing? In this Twitter conversation, which happened less than a year ago, we've got a doctor asking sort of his followers, why don't unmatched doctors who don't have residency programs lined up for this year, why don't they work as nurse practitioners instead? And a nurse thankfully comes to our aid and says, well, because med school doesn't prepare you to be a nurse. And so it's sometimes unfortunate to have, you know, our colleagues not quite understand how unique and specialized our knowledge is, even though there is an overlap. And then sort of presenting that as something that the public could read and think, oh, you know, if a doctor said this, then yeah, that makes sense that nurses are halfway doctors. Nurses are, I think, most often portrayed as unknowing. They're portrayed in ways that make the public think of them as unskilled or uneducated. I was just recently speaking to my uncle even, and I told him, you know, I'm still in the ICU, I'm still at the bedside. And he said, you know, oh yes, you bring the bedpans. And I thought, first of all, that was an incredibly strange way to characterize my job. And, you know, of course, that's part of my work, but he missed the other, I don't know, 99% of what I do that's really exciting, involves, you know, a lot of intelligence, a lot of critical thinking, a lot of hard work. And when I describe sort of the breadth of what being an ICU nurse means, especially to a patient, my uncle was like, I had no idea you did all that. And he is someone who's been in a hospital in an ICU taken care of by critical care nurses before. So in 2015, I have another example here, a Colorado nurse competed in Miss America. And for the talent portion, she delivered a monologue on nursing while dressed in scrubs, and she had a stethoscope around her neck. And the next day on The View, one of the hosts said, why does she have a doctor's stethoscope around her neck? And it sort of spoke to a public that could not connect the work that nurses do and a stethoscope, which seems wild to me, but it's proof that that maybe we're not expressing kind of the really like hands-on skills that we have and we use every day. In another example, on the left, I have a tweet from Dr. Sandra Lee, who's sort of like the infamous Dr. Pimple Popper, who asked why a registered nurse was publishing an article about sunburn versus sun poisoning and why a dermatologist hadn't been asked to do it. And it was unfortunate because it was this person who couldn't fathom the knowledge and communication skills that nurses employ every day in every facet of their work. Fortunately, she got very called out by nurses on Twitter, but the fact that this was seen by her millions of followers was quite disappointing. Nurses have long been described as feminine and also portrayed as sex objects. So on the left, we have Christina Aguilera posing for a Skechers ad campaign, dressed in the way that the public is supposed to understand is a nurse. And on the right, we have Olivia, which some of you may recognize from Grey's Anatomy. She's one of the very few nurses portrayed on the show. Her entire character arc centers around a relationship she has with one of the residents and her diagnosis of syphilis. So her role as a nurse is not well defined, but her role as a woman who has sex with a doctor is made really clear. So, in this hospital, the doctors are doing the really important healing work and the nurses are just some extra drama and nothing more than that. So I worry that when nursing is confused with femininity and also sex, it distracts and sort of delegitimizes the work that we're doing. Finally, we have the conflation of medicine and nursing, which I think I've spoken about before, but when I started to consider going to nursing school, I asked a friend of mine who was a nurse at the time if she thought it was the right choice for me. And she said, well, I know you love Grey's Anatomy, and other than the surgery and, the sex, everything they're doing, the vast majority of it is nursing. So if you like what you see, then nursing will be a great fit for you. And one of the books that I used in developing this presentation, it's called From Silence to Voice. The authors say, nursing is done by doctors on these shows because nursing is really exciting and it's really dramatic, but no one actually gets to see a nurse do it. And that's unfortunate. On the left and on the right, we have some examples of doctors who are sort of in the front doing work that I know is usually done by nurses. And certainly doctors comfort and support their patients in this way frequently, but I think the majority of the time it's nurses who are offering this kind of support. And it's interesting that it's not portrayed that way often on these television shows. So the impact of all of this, the public perception of nursing has negative impacts on the public and on nursing as a profession and on nurses. The overarching theme here is that public discourse around nursing does not acknowledge, the critical thinking, the large foundation of knowledge and the skill that is nursing. And when we hear people complain, that they waited in the emergency room for 5 hours before they saw a doctor, we realize that they don't consider themselves having been cared for those 5 hours, even though they've come into contact with, at least 1 to 2 nurses who have initiated a lot of care already. But because doctors may have not been present, they just don't think they got the care they deserved. When the public see nurses in real life behaving differently from how they perceive they should behave, they might react negatively. Where are the doctors? I'm not getting cared for. I had a patient ask me, what are you writing all the time? He thought I was like busy writing a novel and not taking care of him. And I had to explain, well, I have to document all my assessments, your responses. I'm writing your vitals down. I'm documenting medication. And it blew his mind because for the days he'd been in the hospital for, he thought we were all just busy doodling. I'm not sure what he thought we were doing. If the public don't value nurses and nursing, the public won't feel the need maybe to press policymakers and politicians to address, recruitment issues, safe staffing issues, retention issues. And these are all issues that have been particularly relevant during this pandemic. In BC, we have a contract negotiation coming up. And I wonder how, being seen as a nurse and a hero comes in and sort of complicates our argument, because if the public think of us as heroes who generally aren't in it for the money, or we're doing something that comes naturally, or doing something that isn't as hard as other professions that require a lot of education. I worry that our argument towards, fair wages kind of gets lost in the mix. So I have some recommendations for nurses, essentially at all levels of practice. And it breaks down to 4 categories. One is speaking to the media. The second is research, the third is leadership, and the fourth is education. And they all overlap pretty significantly. So in terms of media, we want nurses to help make nursing more visible. So on an individual level, that means, speaking publicly about the work you're doing to your friends, to your family, to people you meet, and being really honest about what that work looks like and the diversity of the ways in which nurses work. And we also want nurses sort of on a bigger level, maybe speaking on behalf of hospitals, sort of representing nursing and also leadership at the same time, and showing that, nurses have a role in really significant policy changes in hospitals, program initiation, policy development, and research that improves patient outcomes. And that this is something that nurses are valued for and are essential for. In terms of research, we want nurses to conduct research, but then be able to provide it to the public, not just to, conferences and journals, but sort of like reveal what they've been doing at their desks and explain to the public, this is what we as nurses have been working on, and this is why it matters to you. And this is really exciting, and we've worked really hard, and sort of like advertising the work that nurses do. In terms of leadership, I think I've already touched on that quite a bit, but sort of demonstrating that nurses are leaders, and that they are decision makers and stakeholders, and that they can safeguard, the profession and their patients in their work. And in terms of education, I think that sort of educating nurses and student nurses really early on about this issue and about the issue of representation of nursing to the public could be extremely beneficial. And there is some talk about, bringing pop culture into the classroom, using it to help nurses consume cultural products like medical dramas critically, and helping others do the same. So in conclusion, nurses are, in my opinion, not well portrayed in the media, and that both public and nurses are affected by this, but that nurses are sort of the solution to this problem. And I think we've often referred to in the literature as a profession as sleeping giants, because we take up such a huge proportion of healthcare professionals, but we often sort of let other health professionals talk for us, or we don't speak up for ourselves. So I think it's sort of a reminder that when we don't do that, we hurt ourselves and we hurt the public. And that's everything.
Thank you, Hannah. That was an excellent presentation. You gave me goosebumps. So I hope that was the case for a lot of people, for sure. We definitely haven't done a good job of presenting the work that we do as a profession. Maybe this will be the impetus for that change. And your
So
presentation definitely helped with that, I think. Does anybody have any questions they'd like to ask Hannah?
So I totally, completely agree with you. And somebody told me nurses don't do research, and it made me so angry. So we gotta make that stop. About 2 years ago, I think I came to the conclusion that we as nurses need to when I was listening to some physician talk about the nursing shortage, I was like, this is so wrong. Why are they not asking nurses for this? Talking to the media is never easy. And physicians and other people who do it on a regular basis, they often get access to training. So if you look around for that training to help you do that. And one of the things that I've learned over my course, because I've actually got onto the radio once or twice now, is most hospitals have a communication department. Make friends with them and say, you know what, if you ever want anyone to speak on nursing issues, tap me on it. And they can coach you through making that first, endeavors into speaking to the media. But I think we need to have a variety of nurses who are unafraid and supported in speaking to media.
I think that's exactly it. Media training, and then having more than one voice and one type of nurse. I think even as a nurse, I'm sometimes surprised by what nurses do. And I can only imagine it's that much more difficult for the public to even grasp that. And I think the more nurses sort of speak about the work they're doing, the better of a job we're doing of saying, like, this is nursing and you need us, and you should be excited by the work that we're doing.
And come join us.
Yeah, absolutely.
Alana, you've got a question, your hand up.
Yeah, thank you, Hannah, for bringing up a whole bunch of things that have been bugging me for a long time. I haven't watched a medical drama since my first year of nursing school, so, that happened. I'm wondering for yourself, so I think it's amazing to have leaders like yourself doing this work and, putting that voice out there and working on this. Where do you see this going? Like 10 years from now, what would you like to see different?
It could be something as simple as when there are issues related to healthcare, a nurse's voice is included, and not just to say, we're tired, our masks really hurt, we're hot all the time, it's hard watching people die, but nurses saying, we built COVID units and this is how we did it, and we were instrumental in it. And, this is our role in supporting patients on ECMO, that we're really hands-on, and sort of being the ones that the media want to talk to, and becoming a familiar face and a familiar representation for those issues. I think that would be fairly simple and make a pretty big impact.
Okay. Thank you very much, Hannah. That was excellent.
Thanks for watching, everyone, and thank you for joining us on the BC chapter of the CACCN YouTube channel. We have a lot of great content, both recorded, and we're just in the process of cleaning up and getting it ready for YouTube, but also from previous events we've had over the past 12 months. I would suggest subscribe and hit the notification button so you can know when the next thing is out. And if you ever want to come to our next event, we're on Facebook and on Instagram. Our links are listed below. And while I'm on the topic, if you're a critical care nurse anywhere in Canada, why don't you join CACCN? We have a ton of resources to help you be the best critical care nurse you can be. Go to caccn.ca and join us.